There's a particular kind of ache that lands on many women with ADHD. A sharp, immediate pain from perceived rejection, a cascade of shame after a small error, or a sudden tidal wave of exhaustion that leaves you unable to move. If that sounds familiar, you're not alone and you're not overreacting. These experiences are rooted in measurable brain differences and predictable neurobiology. First, what is rejection-sensitive dysphoria? RSD. RSD describes an extreme emotional reaction to perceived rejection, criticism, or failure. People experiencing RSD report near-instant intense shame, humiliation, or emotional pain, often disproportionate to the trigger. Although RSD is not a formal DSM diagnosis, clinicians and ADHD specialists widely recognize it as a common debilitating experience among people with ADHD. Authoritative medical resources describe RSD as intense emotional pain linked to differences in emotion regulation in ADHD. How does RSD fit into the bigger picture of emotional dysregulation in ADHD? Research reviews and clinical studies consistently identify emotion dysregulation, difficulty modulating intensity and duration of emotional responses, as a core and measurable feature in many adults with ADHD. That means people with ADHD often experience larger emotional reactions, slower return to baseline, and more frequent mood swings than the general population. A 2023 systematic review synthesizing neurobehavioral and brain activity studies concluded that emotion dysregulation is reliably elevated in adults with ADHD and linked to impaired functioning. Neuroscience explains the mechanics in a compact way. 3 brain systems commonly involved in attention and emotion are out of sync. Executive control systems, the prefrontal cortex, are the brake pedals. They plan, inhibit, and organize. In ADHD, these brakes are underactive or taxed, making regulation harder. Reward and motivation circuits, dopamine pathways, drive what we pursue and how rewarding we find it. In ADHD, these circuits are dysregulated, making sustained, low-salience tasks feel unrewarding. Threat/salience systems, amygdala, and related networks trigger fast emotional responses. With weaker top-down control, these systems can tilt the brain toward high reactivity. When the threat system fires, even for a small social cue, the prefrontal brakes struggle to reassert control. The result is the intense, fast, and often shame-laced reaction we recognize as RSD. This is not moral failure. It is neurobiology. Women's experiences can be especially complex because hormonal cycles interact with neurotransmitters that support attention and mood. Emerging clinical observations and reviews indicate many women report worse ADHD symptoms and emotional reactivity in the premenstrual and late luteal phases when estrogen dips, which can directly amplify RSD-type responses and lower resilience to daily stressors. Planning for the cycle is not optional for many women. It's practical medicine. Now, the second part of the picture, ADHD burnout. Burnout here is not just being tired. It's an exhaustion that accumulates after chronic overcompensation. Think of years of masking, hypervigilance, adrenaline-fueled coping, and micro-failures that never got repaired. Over time, the executive bank goes negative. Decision-making slows, emotional regulation frays, sensory inputs feel raw, and motivation evaporates. Clinical accounts and patient reports describe an unmistakable pattern: poor sleep, loss of tolerance for noise and demands, brain fog, and low mood. Recognizing burnout as distinct from ordinary stress enables triage. First stop the bleeding, then rebuild. Important evidence-backed points to hold. RSD-like reactions are common among people with ADHD and tied to emotion regulation difficulties. This is supported by clinical resources and medical reviews. Emotional dysregulation in adult ADHD is measurable and linked to functional impairment. It's not just temperament. Female hormonal cycles can change ADHD symptom severity across the month. Recognizing this reduces shame and allows smarter planning. So what must change? 2 things: immediate regulation that stops the spiral and sustainable systems, environmental scaffolds, therapy, and skills that prevent repeated depletion. In the next part, we'll build a practical, evidence-aligned toolbox to do exactly that, with mindfulness, CBT/DBT, driven emotion skills, RSD-specific language, and daily templates you can use immediately. Recovery and rewiring, a practical, evidence-aligned toolset, mindfulness, emotion regulation, and RSD strategies. Immediate stabilizers. Stop the spiral. These are the emergency tools that buy space and restore cognitive access. Recentering phase, 90 to 120 seconds. Right after a trigger or when you notice escalation, do this short, evidence-aligned reset. Place one hand on your chest, one on your belly. Feel the breath. Inhale for 4, hold 1, exhale for 6, repeat 3 times. Name 5 objects you see, 3 textures you feel, 1 sound you hear. Press your feet into the floor and slow your breathing for 10 seconds. These micro-interventions reduce sympathetic arousal, raise vagal tone, and restore prefrontal access so you can actually use your scripts and decisions. Use it often. It's the hinge between panic and planning. 2-minute distress protocols. Keep a 2-minute card in your phone. Options: paced breathing, a cold water splash on the face, or a very brief movement set. These quick rituals break the cortisol loop and prevent escalation. Grounding check script. For RSD moments. When a perceived slight hits, say out loud, "I'm noticing hurt. I don't have to act on it right now. I will recheck facts in 20 minutes." This simple time-based cooling off reduces reactive actions that often worsen social consequences. Mindfulness as both practice and portal. Mindfulness-based interventions, MBIs, structured programs that teach present moment awareness, have accumulating evidence for reducing ADHD symptoms and improving attention and emotional balance in adults. Meta-analyses and controlled studies show MBIs can reduce core ADHD symptoms and improve mood attention with moderate effect sizes. While more high-quality trials are still needed, mindfulness is a high-utility, low-risk complement to therapy and medication. Incorporate short formal practice, 10 to 15 minutes daily, and informal micro-practices, 3 deep breaths before opening email, a 1-minute body scan at midday, to rebuild attentional control and reduce reactivity. How to use mindfulness practically for RSD and overwhelm. RSD, specific mindfulness. Notice the physical sensations tied to perceived rejection, heat in the chest, tight throat, label them, and practice non-judgmental naming for 2 minutes. Naming reduces amygdala reactivity and increases cognitive distance. Micro-meditation, a 2 to 5 minute breath counting practice when an emotional cue appears. This builds tolerance, which shrinks the reactive spike over time. CBT and DBT techniques, skill training that sticks. Cognitive behavioral therapy, CBT, adapted for adult ADHD, focuses on breaking catastrophic thinking, building implementation intentions, and structuring the environment. DBT, dialectical behavior therapy, gives us concrete distress tolerance and emotion regulation skills that map perfectly to RSD moments. Radical acceptance, opposite action, and paced exposure. Practical CBT/DBT tools to practice daily. Labeling and scaling. When overwhelmed, label the emotion and scale intensity, 0 to 10. This simple habit externalizes and fragments the emotion, making it more workable. Opposite action. DBT. If you feel like immediately withdrawing, intentionally send a short neutral message instead. Opposite action interrupts reflexive avoidance. Behavioral activation. Schedule tiny, finishable tasks, 5 to 15 minutes, each day for micro wins that restore dopamine and competence. Meta-analyses show CBT reduces core ADHD symptoms and mood comorbidity when used alongside behavioral supports. It's a cornerstone of long-term recovery. Why this approach works. Concise science. Mindfulness, MBIs, reduce ADHD symptoms and improve attention, emotional balance with medium effects in trials. They increase present moment awareness and decrease reactivity. CBT/DBT provides skill training for reappraisal and distress tolerance. Meta-analytic evidence supports CBT's benefit for ADHD-related symptoms and mood comorbidity. Immediate physiological resets. Breathing, grounding, rapidly reduce arousal, improving prefrontal function so the skills and scripts can be used. If this landed, save the video and try the 4-week starter plan. If you want, I'll turn this into a printable RSD script bank, a 7-day recentering card, or a 4-week tiered planner formatted for women with ADHD. Subscribe for more tools that respect your brain and help you thrive. Gently, powerfully, and without shame.